AM 1240 WGBB.com, and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. Thanks for tuning in tonight. We have a great show tonight. Our guest is Dr. Richard Sigismondi, and before I introduce him, I want to tell you how this show came about. You know, a lot of our listeners have been frustrated about dentistry not lasting, and why doesn't dentistry last longer, and why isn't it more durable? And I did a lot of research, and I tried to find out why that is and who's the expert really in durable dentistry. And Dr. Sigismondi's name really kept coming up, so I've nicknamed him Dr. Durable. But what he's going to really talk about tonight is why doesn't dentistry last, and really what his unique approach is in terms of helping people have dentistry that lasts them a lifetime. So, Dr. Sigismondi, I want to welcome you to the show.
Well, thank you very much for having me on the show. I really appreciate it.
Glad you could make it down. Take some time out of your schedule. So before we get started, let's just talk a little bit about where you grew up, where you went to dental school, that sort of thing.
Well, I grew up not that far from here, as a matter of fact. I grew up in Brentwood, Long Island. I went to Brentwood High School, as a matter of fact. Graduated in 1972 and went to State University of New York at Stony Brook. Got my degree in biology there, and then went to dental school. Went out of state for that, went to Washington University in St. Louis, and attended dental school there. And
I know you're from a very dental family, so just tell our listeners about that a little bit.
Well, I am, as a matter of fact. Sometimes it seems like I've been in this field forever, and that's really because I have been. I started working in dental laboratory, my father's dental laboratory, when I was 15 years old. So he taught me a lot about what it was like to take care of all the, make teeth and make dentures. I started out pretty simply at a very low cost, but I learned an awful lot from my father.
And your sister's also a dental hygienist.
Yes, she is. So we've covered the base. My mom was a receptionist in a dental office as well.
Is that right?
Yeah.
Is that right? So it was meant to be. How old were you when you knew you wanted to be a dentist?
Pretty early on, actually, when I was working with my father. He had a lot of different accounts, different dentists that he worked for, and to me, it was just working in his in the office with my father. It didn't really hit until he got one account, which really taught me an awful lot about how teeth work and how important it was to make things work together with the function in the mouth. We did things very differently for the dentist that worked like this. And my father taught me all the philosophy of how these teeth are designed to work within the parameters of the muscles.
Now, I know when we were talking before the show about durability and really your unique approach, what I got from our conversation and what I want you to share with our listeners a little about is most dentists are in the reparative mode. In other words, they see a problem, they fix the problem, and their thought process never goes beyond that. But you were telling me that your process really is you see a problem, and before you fix the problem, you sort of take a step back and you say, well, why did this problem occur? And let's fix it differently, or let's try and get to the reason why it occurred rather than just fix it. And that's comes to the Dr. Durable thing, comes to the durability of your dentistry. So let's talk a little bit about how you became exposed to that philosophy and really tell us what it means.
Well, I became exposed to the philosophy by studying with a fellow by the name of Dr. Pete Dawson down in Florida, who I started studying with him back in 1996, and my goal was, at the time, I'd been practicing for a number of years, and I really wanted my dentistry to last a long, long time. I really wanted it to I wanted to have the best dentistry that I could possibly perform. So I went to him seeking that, and I learned so much more than I ever anticipated about how things work with muscles, what the joint has to do with the whole interaction of teeth. And from there, I just developed this whole approach that is going to make things work. And amazingly, when you do that, everything looks great as well.
So I know a lot of dentists take the approach almost like each tooth is its own little world, and the teeth almost don't interact with each other. But what you're saying is the whole mouth is really the unit, the organ unto itself. So tell listeners what that means.
Well, that's a nice way of putting it, because it really is a fairly holistic approach What we really want to do is we want to look at things proactively. We want to see, okay, what made things happen in this person's mouth? Let's face it, we're born with the most amazing things in our mouth that God made. We're never going to be able to duplicate that in any way. And anyone who thinks that they're going to do better than that is only fooling themselves. So here we are in this position where suddenly we want to make things work and hold up even better than what God gave them. It's a tall order. So it really warrants stepping back and evaluating things.
What are the biggest reasons you see that dentistry doesn't hold up?
Well, besides not regular care, that's a really big one. People aren't educated as to what they need to do. Brushing, flossing, things like that, the things that require everyday maintenance. These things don't maintain themselves. They really do need to be cared for, even though it's really not all that much. Secondly, probably the thing that's probably most ignored is that teeth exist in function, not just simply chewing up and down. Yes, that does occur when we chew, but in our mouths there's a lot of different things that occur. Some people grind their teeth, some people chew on things. And everybody's mouth is a little bit different in the way that they do function. So what I do is I really look at people's mouths, how they work and function. I replicate their bite, so to speak, with models, and I take a look and see what happens in their mouth, what has occurred, and try and piece together why they are the way they are now.
Mm-hmm. And then you correct the underlying issues if they can be, and that almost frees the dentistry to last much longer.
Exactly. When things exist in harmony with the function in your mouth, they will last.
It's kind of like with a car. If you drive a car under harsh, dusty conditions, it doesn't last as much as if it's driven, on Sundays to church downhill both ways. It lasts much longer.
The analogies are quite similar, both in terms of maintenance and understanding what needs to go into building a car that's going to last.
Do you see a lot of patients who haven't been to the dentist in a long time?
Yeah, a lot, actually, because when I see new patients, my typical new patient is somebody that's referred to the practice. And while we do get people who just come in because they're changing dentists for one reason or another, by and large, a lot of people are people that have had either dentistry that they've had replaced over and over again, has been failing, and they can't understand why. Or there are people that come in that they kind of waited. They knew things were brewing in their mouth, and they put things off, and finally they're there, and they just come in and say, okay, I need to get things fixed.
Mm-hmm. It's interesting what you said. Your reputation on the South Shore has been someone who produces very durable dentistry because of the approach that you take, and I can understand why people frustrated with a history of lifetimes redos would come in to seek that type of dentistry. It's got to be very frustrating for a patient to always have to redo things or have their dentistry not last.
It is, and they don't understand why. And a lot of times it's because the time was never taken to stop, evaluate things, and explain things to the patient.
So what's the process like in your office? A new patient comes into your office. Take me through, from that first phone call to when my teeth are sparkling new and dazzling. What's that process like?
Well, when a patient comes to our office for the first visit, we do things a lot differently than a lot of other offices. First of all, we spend a lot of time. The patient's advised of that ahead of time. If a patient has some time constraints, sometimes we divide it up, but typically it's nice to be able to concentrate solely on this patient with a lot of time. Starts off with an interview. I want to sit down in my private office, not in a dental chair. I don't want to have any kind of distractions where a patient's looking at dental equipment, things like that. I want to sit face to face, look them deep in their eyes, and ask them questions. I want to know, what are they looking for? What are their issues? I ask them about their family's teeth. I ask them how they feel about their smile. I ask them what their expectations are. I want to know as much about them as I possibly can.
I bet you most people have never had that experience before.
They're kind of floored when they're asked questions about how do you feel about your smile, or where do you see your teeth or your smile 15 years from now.
Why do you ask them that stuff?
Well, I want to know if they are the type of person that is just going to seek immediate care for one single problem, or whether or not they value something that is going to last a long time. There are different types, and basically they're not really different types. They're just kind of like different parts of a spectrum. So the people that might not be in tune to it, I'm going to spend more time trying to educate them.
Mm-hmm. I know you were telling me that you live really in the community where you practice, and that your relationship with your patients is paramount, because not only do you see them in the office, but you see them at the store and on the golf course and everywhere else.
It's true. I enjoy that lifestyle. I mean, it's part of my personality. I like to develop that relationship with them. Ultimately, most patients that come to the practice become friends. It's kind of funny after they've gone through all the treatment and they're just in that maintenance mode that, we spend a lot of time just kibitzing about things. But it's nice to be able to run into patients out on the street for whatever reason, or in the supermarket or a hardware store, and just meet them as friends.
I would venture to say that almost no one has ever had the experience where a doctor took the time just to learn about them, understand what their expectations are. I mean, certainly going to a physician, they don't even want to look you in the eye. They just want to know what your problem is and here's your prescription. I think that approach is really unique. So after you get done just talking with the patient, getting to know them a little bit, helping to understand what their expectations are, what's the next step clinically that happens?
Well, once we go over their health history to determine if there are any health issues and get all the particulars about their physician, we then go into the treatment room. And from that point, they sit down, and I share with them what's going on in their mouth. And the way we do this is they get to see the images of their teeth up on a TV screen, magnified many times. It helps me to see things, and it also helps me to stop and point things out each step of the way. What's good, what's not good, how it varies from being healthy. So we look at all that. We look at their teeth. We look at their gums. Once we do the demonstration, then I do my clinical exam, look for cavities. We look for periodontal disease. We look for soft tissue concerns like oral cancer, TMJ problems, and we go through a very detailed workup of all the soft tissue. Mm-hmm. Joint, smile, things like that. They can take more time, especially if people have some issues. The more problems they have, the more the more detailed the exam gets.
Mm-hmm. So it's pretty customized to their particular needs at that point.
Absolutely. My goal, though, is to find out everything that's going on in there.
And then do you tell them about what their options are at that visit, or how does that happen as far as them learning what's necessary to get their mouth healthy?
We don't really address it on the first appointment, mainly because we need to gather a lot of records. The patient needs to have some x-rays taken. We use the digital x-rays so that they don't get a lot of radiation. We really want to respect their health and keep that to a minimum. But we take photographs, which are really valuable. Mm-hmm. It's amazing how much you can see on a photograph blown up on a large computer screen that you might miss even in the just by looking in their mouth clinically. And then, of course, we take some models. Mm-hmm. I really feel that evaluating a person's bite is very important, and I like to be able to do that outside of their mouth. We mount these models on a very sophisticated hinge apparatus that works just like their jaw does. It goes up and down the way their jaw does, and side to side and all that.
Do people are people put off that they have this whole long visit and they have to come back another visit? What's their reaction usually like after they finish that exam?
Well, everybody's personality is different. By and large, almost everybody goes to the front desk at the end of the appointment and says, "I've never had an exam quite that thorough before in my life."
Is that right? And then we're going to take a fast break, and then after the break, we're going to talk about your conversation with them afterwards. So I'm Dr. David Scharf. You're listening to Healthy Living Radio.
This is Healthy Living Radio with Dr. David Scharf.
I'm back, Dr. David Scharf. You're listening to Healthy Living Radio, and we have as our guest tonight Dr. Durable, Dr. Richard Sigismondi. I think that's going to stick after tonight.
Okay.
So you took us through the exam process, and so when the patients come in to understand what their situation is, what their options are, do you encourage them to bring somebody? Do they come by themselves? How does that work?
Absolutely. I really want them to bring somebody with them because, again, we're going to spend a fair amount of time in our discussion as to what my findings are. Not that it always takes a lot of time, but I want to allow the time to have questions answered, and I want to encourage their questions. We try to keep the jargon as non-technical as possible so that it's completely on lay terms. But still, depending upon a person's needs, there may be a lot of stuff that is covered. And it's nice to have somebody there that can remind somebody after the fact, after they leave. It's also comforting to have somebody to share the experience with so they can talk about it more while they're there instead of trying to get everything in, then trying to relieve them. It's an awkward thing if they try to do it that way.
What an awesome experience just to have that whole thing. Just no one does that, to spend that kind of time with people and really be committed to educating them. But it sort of makes sense if you back into the whole concept that the people are your friends and they're part of your community ultimately that you want. You treat them just like you would treat a family member to help them understand what their problems are and be thorough in what you do.
It's building a relationship as well as being thorough. We want to start that really from the start.
You said before that you see a lot of patients who maybe haven't been to the dentist in a long time. And what are the main reasons you find that people stay away from dentistry?
There are really about 5 reasons why people stay away from dentistry. One of them is fear. Unfortunately, in that respect, fears come from a lot of things: superstitions, myths, some bad experiences from their youth. And so we're mindful of that every time a person walks in the chair. I assume that everyone that comes into the office is fearful to a certain extent. So we take certain measures to really, really, really try to allay those fears. Probably the most important thing and the best thing that we've ever done in our life is develop a way to make people numb comfortably. We numb them before they get numb. And it's kind of surprising because sometimes people will stop and say, "Wait a minute, you just numbed me."
Oh, yeah.
and that's a real good compliment because we really want them to be nice and comfortable.
I'm sure they appreciate that you take that time, too, because, a lot of dentists don't. A lot of dentists are in such a rush. And talking to you, the sense I get is there's no sense of rush in your office at all, that it's really just a comfortable, nice, comfortable pace with people. So we spoke about fear, and you spoke about that. What are the other 4 reasons people stay away from the dentist?
Well, obviously a big thing is cost, especially in our economy today. And, we invite people to come to our office who have insurance, and with the insurance, we try to maximize their insurance as much as we possibly can. Our front desk is very adept at contacting the insurance and make sure they get every dollar's worth out of it. We also have every kind of possible financial arrangement that we can offer to make it so that people get healthy.
So people can fit their dentistry into their monthly budget, like their cable bill or their cell phone bill. They don't have to pay the whole thing up front. It doesn't have to be a budget buster. You
bet. We understand that, and we want to make it work for them. And we don't want to make it an uncomfortable thing to have to get their mouth healthy.
What's interesting is we were talking about just cost and value. I mean, if you're producing dentistry that's lasting significantly longer than average, it's the best value in town, because nothing, even if you're spending the same or a little more up front, which they're not in your office, it's the same. The fact that it's lasting so much longer because of your approach makes it a fantastic value.
It is. It's kind of surprising to me sometimes that insurance companies never look at it that way, and they have all the actuaries. They're content to have crowns last 5 years and then have to replace them. And most self-respecting dentists think 5 years is far too short.
It's nothing. So we have fear, we have cost. What are the other reasons people stay away?
People's time, especially if they feel like, well, there's a lot of things that need to be done.
No one has time nowadays. No. Everyone's too busy.
Absolutely. So I try to. I like my appointments to be as long as a person can give me their amount of time.
So you get as much done in as few visits as possible, if that's what they want to do.
Right. If you're going to be numb in an area, I really want to get everything done I possibly can. I'm really mindful of that. I don't want a person to feel like they have to live in my office. I want to get them moving along and into the maintenance phase of things as quickly as possible. Mm-hmm. So we like to make the appointments enough to get a lot of things done.
And what are the other 2 reasons? You said there were 5.
Well, there's always that sense of urgency. Sometimes people feel like, well, I can put it off. It's not a really big thing. People like that live with emergencies. Mm-hmm. It just happens.
Is that when the phone rings Sunday morning? Dr. Sigismondi, I know you told me I should have taken care of this.
It is. I'm on call 24/7, and sure enough, usually when a person calls up after hours, it's prefaced with, I know you told me this was going to happen. And I said, well, that's okay. What's up? And I encourage them to tell me the story. And we get them fixed up. But then again, when they do come in, we try to right the path and say, okay, we have emergency care, but You don't want to live like that. We want to get you so that you can...
They're always at the worst time, before a big meeting, before a holiday, before a special event. That's when the infection always seems to happen.
Exactly. Going on vacation, you name it.
Yep. And what's the last reason?
The last one is trust, and probably that's the most important thing. And that's indicative of just about every field in this world today. I think, by and large, there's a certain element in our society that people always feel like they're trying to be sold. Mm-hmm. And it's really important just to gain a person's trust. You really want to open up those a dialogue with patients. You really want to make them open up and feel comfortable with you.
You know what I think a lot of people don't realize but slowly are? People sometimes change doctors and dentists, every year when their insurance changes. So they never give themselves the opportunity to establish trust with somebody because they constantly change. How could they? And most people don't take your approach to really make having a relationship almost more important than having the dentistry. I mean, it sounds like the relationship is number one. And okay, after we have a relationship and there's that level of understanding between us, then we'll talk about dentistry.
Exactly. Right.
So does every patient coming into your office end up needing, 42 crowns and a whole big redo?
Absolutely not. A lot of people come in, they need the most basic thing. But most of all, they just need to know that they've got an ally. They've got someone, an advocate of their health in the corner. And really that's an important thing, because it's not about just performing dentistry on a person. You build a relationship, they refer somebody else.
Mm-hmm. What I assume a lot of these kinds of cases that you really change people's mouths dramatically. I mean, if someone's been away from the dentist and their teeth don't look the way they want or their breath isn't the way they want it to be, I would imagine once it's done, there are some dramatic changes. And let's talk about that. I mean, what are some of the changes you've seen in your patients?
Well, they've been really quite amazing. And that's really the most rewarding part of this field. So many people go into it and they just think that all we do all day is fix teeth. Mm-hmm. And it's not. It's not really like that at all. I've had patients cry in my office with delight. Mm-hmm. People who, I've had women who always hated to smile. If you ask them, I want to take a picture, could you smile? And they say, I never smile. And they go through our treatment, they get their mouths fixed up, and they're out someplace and somebody will say to them, I love your smile. And they do a double take, like, are you talking to me? And when I hear a story like that, it makes me feel so good, because I know that their confidence level, their self-esteem is so much better because of that.
It's not just teeth. I mean, teeth have such a profound effect on somebody's personality. I think a lot of people don't realize that sometimes.
Really, it does. I mean, whether you're, whether you're a salesperson, you just feel like, I'm talking with people all the time, and I feel like they're looking at my mouth thinking, like, what's wrong with this guy? I mean, those are issues. I mean, there's a multitude.
I had a guest on the show a couple of weeks ago who told me the story that he had a patient who's a gentleman whose mouth was really in disrepair, and he'd been unemployed for quite a while, went on interview after interview, and he realized that it wasn't just how his teeth looked that were holding him back, but it's how his teeth made him feel. The way his teeth made him feel was sapping his confidence. Mm-hmm. And probably by no coincidence, he really fixed his teeth, and he got a job shortly thereafter because his confidence, he had that spring in his step that he just didn't have before. He felt like he was on a par with everybody else now, or better. People really focus on a smile. It's really the most important asset that anyone could have. What do you say to people who say, I'm too old for this, and they find any age, right? I'm 40, I'm 50, I'm 60, I'm 70. I'm too old to fix my teeth. What do you say to those people? Well, I really think that they're wrong, that's for sure, because you're never too old to fix their teeth. And, the older person gets, the greater the wall of objection becomes from either them or, sadly, sometimes even their family. Mm-hmm. And I relay a personal story that, my mom, she wound up having to go into a nursing home because she had Alzheimer's. And when I went to go visit her, I would look around and I would feel really good for my mom, because I knew that her teeth were in really good shape. And it sounds weird to say that, but she was able to chew her food. She was able to maintain her health because of it. She had her dignity. She could still smile. When I would look around at all the other people, most people didn't have teeth. Most people, if they had them, they lost them. They couldn't eat properly. It was very sad. I bet you most people in their 50s and 60s and 70s never really stop to think, it's what I'm doing now that's going to affect my future. When you're 18 and 20, you go to college, and a lot of people can think, all right, I'm going to go to college and I'll have a different future maybe than if I don't go to college. Or if I get married and have a family, I'll have a certain future as opposed to if I don't. I bet you most people don't stop to think, well, if I take a comprehensive approach to my teeth, don't just let the future happen, but take control of my dental future, well, this is how I'll be when I'm older, when maybe my vision or my mobility has been taken from me or all those things. You're not going to take my teeth away from me because eating is the one thing I want to do until the end.
Right. I think that it's pretty well established. That's the generation that thought we were going to lose our teeth as we got older. That concept is long gone. These teeth are really meant to last a lifetime. They take a little bit of input along the way, and that's my job to help keep them on the path. And so that's what we do.
Do you ever find that people come in and they feel guilty almost about wanting to get their mouth in shape?
Yeah, that's a common thing with you're a middle-aged type person. They've always taken care of their kids. It's always been everybody else's turn. So a lot of times people come into the office and they feel like, okay, it's my turn. I really finally want to do something for myself, to get myself in shape. And the teeth is a lot of times where they start. But a lot of times they still have a lot of guilt pangs.
Well, they have the guilt pangs before. What about when it's done? Does the guilt leave them, or do they still feel guilty about having done it?
You never have anyone feel like, oh, I wish I didn't go through this. Everyone is always really grateful to be able to do that. And
is their biggest regret typically that they didn't do it sooner?
Usually, yeah, because first of all, they realize that they look better, they're way more comfortable, and they just feel healthier. Mm-hmm. They go to the dentist. It's a normal experience now, and there's nothing uncomfortable. They go there, and it's pleasant.
Do you find that most spouses are supportive of people's endeavors when they want to fix their teeth, or maybe not so supportive?
I find them usually to be very supportive. Usually, once one spouse has gone through some treatment, their spouse comes in, the kids come in. It becomes a big. They want to spread the word.
I would think for the spouse, they get a tremendous amount out of it also. Number one, the person they stare at all the time looks better, and the person probably has a sparkle back in their eye. They feel better about themselves. They're more upbeat. They have like a rejuvenation. They get to be with someone that's rejuvenated.
Truly, it does make you healthier and really younger in that respect.
What are some of the older patients you've treated? Have you treated patients in their 80s, their 90s, 100? What's the oldest patient you've ever treated?
102 years old.
That's a record for the show, by the way. The previous record was 98. Congratulations.
And she was the sweetest lady, and she had dentures that didn't fit for years. And dentistry, making dentures is almost like a lost art. A lot of people gloss over it because it's not as easily measured and defined as some other things in dentistry. But again, the laboratory experience from when I was young makes me want to embrace that all the more. And she had a set of dentures, and she just said to me, "I don't know why I didn't meet you 30 years before."
So she suffered. From her 70s until 100. With bad dentures.
Yeah.
What about younger than that? Anybody?
We had a person who was 82 years old who went through orthodontics.
Really?
And
do you do braces in your office?
We do Invisalign. And she said to me one day that I always wished I had straight teeth. I hated my teeth ever since I was a kid, but we could never afford braces. Mm-hmm. I wished I did, and I guess it's just too late. And I said, well, why do you say that? She says, well, I'm pretty old. And I said, well, you're never too old. You have actually good bones, and there's no reason why you can't go through it. So she went through with it. And I'm telling you, she was the biggest proponent of Invisalign after that. She was really thrilled. Everywhere she would go, she would show off her teeth.
And, to your credit, you created an environment in your office where she felt comfortable enough talking to you about what was important to her without the least bit of fear that you would belittle her or make her feel foolish. You just created that warm environment where her feelings could come out. That's more than the dentistry, I think.
Well, again, that's just taking the time, talking to people, asking them questions.
Yeah. The one thing that I've taken away from this show more than anything is you just really have a deep concern for your patients. And people on the radio obviously can't see your face, but I can see your face when you talk about how a patient responded to treatment and how you care about them. And I really, to your credit, a lot of professionals nowadays, it's all about making a buck or getting people in and out, but you really take a very personal approach to your patients, and I give you a lot of credit for that. I think that's something that's not as common nowadays as it used to be.
you ever want to walk away from things at the end of the day feeling like you do for people what you would love to have done for you no matter where you go.
Mm-hmm. So for any of our listeners that maybe want to get in touch with you, can you tell us where you practice, what your phone number is, how people can learn more about your practice?
Sure. My office is in West Sayville on Montauk Highway, in the corner of Montauk Highway and Munson Lane, right across from the West Sayville Golf Course. Our phone number is 631-563-1583. We do have a website. It's www.drsigismondi.com. And let me spell that for you because I know it's not a household name. It's Dr. Sigismondi, Sigismondi. We're also on Facebook now, so you can go to Facebook, just look for Dr. Sigismondi and like us on Facebook. And we keep you up to date on all kinds of stuff.
That's great. You know, there was so much we didn't get to tonight. I mean, you do charitable work we didn't get to talk about. You have tremendous technology in your office we didn't get to talk about. Can I twist your arm to be a guest another night on the show?
I would love to. I really enjoyed being here, and I'd love to do it again.
Thank you. It was a great show. I really appreciate you being on, Rich. It was a terrific show. I enjoyed talking with you, and I really enjoyed you sharing with our listeners how they can have the type of durable, last-your-lifetime dentistry that's very hard to come by, that's just a great investment, and that helps people live out their life with good, strong teeth and that quality of life that those teeth bring. So thanks for sharing that with us tonight. I appreciate it.
Well, thank you very much.
You're listening to Dr. David Scharf on Healthy Living Radio. Thanks for tuning in. We'll be back next week. Have a good night.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.